All right, welcome everyone to the podcast today. This is our first one. I don't know if we'll be doing another one, but I figured with the mental health crisis going on nowadays, maybe some people could benefit from this conversation. So for those of you who don't know, my name is Jeff, and I'm a video agency owner. So I get a little peek into a lot of different people's lives. For instance, if I'm working with a band, I'm there at their band practice. I'm there in the green room with them. If they're playing a show, I'm there at the show. If I'm working with a restaurant, I'm there getting basically a private tour in the kitchen, getting to see how the sausage is made, so to speak. And so this man joining me here today, I think, has one of the most interesting jobs you can possibly have. So with that, would you like to introduce yourself?
I like to think so as well. Hey, everybody, Dr. Mike Ma here. And full disclosure, me and Jeff have been friends since we were 5 years old. I'm a psychiatrist. I practice over in West LA. I usually treat like mood and anxiety disorders. I see people of all ages. Lately, I've been getting into like the social media game, putting some content out there. And being that my best friend over here has started to launch this like media business, we felt like, okay, the door is open. Let's walk through it together and let's get some content out there for the public. And like Jeff said, there is a big mental health crisis these days, and a lot of people have a lot of questions. So hopefully this can be of use for whoever watches. It's good to be here.
Awesome. Thanks for coming.
Of course.
So I was thinking, like as you were mentioning that, I think maybe we should first address that this is not a therapy session.
No.
Right? So certain things we can take a little liberty on, right?
Absolutely.
This isn't your clinical practice.
And much more of a liberty that I can take when I'm actually in practice. It's a good point to start off with. So here, speaking to you and the cameras and whoever's watching, I'll be here in a bit of a different capacity, not a bit, a different capacity than you would find me if you were my patient sitting in my office. I think one of the topics we'll talk about later is self-disclosure. How much of myself and my life and my opinions do I bring to the visit? Sneak preview, not much, maybe none. Where here, it's a little bit more casual. We're talking to a general audience, and I'm sitting here next to someone that's known me my whole life. So here, a little bit more loose, a little less measured as far as maintaining some sort of specific strategic dynamic.
Yeah, boundaries, so to speak.
Boundaries, absolutely.
Yeah.
And a little bit of a different goal as to the purpose of this interaction.
Yeah, so when talking about the mental health crisis nowadays, in my mind, I've always kind of viewed it's kind of a difficult topic because there's a lot of pressures on modern people with modern society, right? And the way that modern society is going right now probably contributes a lot to people's mental health problems, right?
Certainly.
And then we introduce a modern solution, which makes sense, but how do we know the modern solution is the proper solution and not just more modernity introducing more problems?
I suppose we should break that down as to first of all, what is this modern solution you're talking about? And what are these modern forces? And I agree with you. Patients ask me all the time, I'm like, listen, I could write a book about what today's culture, society, technology, the rest of it, all the ways in which this is negatively impacting people's mental health on a grand scale. So my question to you would be, what modern solution are you talking about?
Specifically, modern pharmaceuticals, the act of talking to someone about your problems in the first place, as opposed to taking action, obviously, I don't know if this is true, but when I think about people living back in the day, like they probably didn't have a lot of time to, sit and talk about things, right? Like, should people just be getting up and running or like something like that, So but mainly modern pharmaceuticals would be like a modern solution to
there's 2 points there that you could dig into. You can tell me which one you want to talk about first. One is this era of people not being so busy. There's less physical, demands on you that require time throughout the day. A lot of things are automated. There's less external tasks or whatever that are requiring your attention. A lot of people are spending much more time thinking about themselves, introspective.
Yes.
And as we will learn later, I don't know if this will come up, but a lot of people that are suffering from mental illness are spending too much time thinking about themselves, how they're feeling, and how they're suffering. So one, back in the day, I mean, maybe people were just as mentally ill, I don't know, but there was so much that demanded their attention be directed externally.
Immediate attention.
Immediate.
Yeah.
For their basic needs to be met. And these days, a lot of people are spending a lot of time thinking about themselves and how they're feeling in their internal environment. A lot of social influence there too. I mean, mental health and mental illness, forget being destigmatized, it's now being normalized. Now that's one branch as far as where is one's attention pointed to, and us having more time and luxury to point it inward. And when that balance gets shifted to introspective and how that can actually be a problem. And then, correct me, the other point is, at what point do we seek pharmacology? At what point is our inability to engage in healthy action to try to climb out of whatever hole we're in? At what point should that translate to seeking professional care? Is that what we're going with?
That was exactly my question. And if it's even worth it at all to do,
Yes. What, seek professional care or what?
Seek professional care, rely on modern pharmaceuticals, right?
Yes.
Like, I'm of the opinion that if you're drowning, then you get whatever you grab onto whatever life preserver is thrown your way.
100%.
Right. But I think there is generally a stigma, especially nowadays, a growing modern stigma of reliance on pharmaceuticals. So I think maybe we should hit on the topic of using them judiciously, and when they're not appropriate.
Yes. It's interesting you bring up this like analogy as far as like drowning, right? Now, I'll work my way as to when it's time for someone to actually seek an evaluation for mind-altering medications and pharmaceuticals. But that analogy, I love it. I use a similar one. As far as, treating depression, anxiety, things not like schizophrenia where medications are absolutely necessary. Those are absolutely necessary. So for me, when I'm treating patients with like depression, anxiety, trauma, the analogy I like to use is that the medications are like floaties in a pool, right?
Yeah.
They will lighten your load. They will prevent you from sinking, but they will not swim for you.
You still have to swim yourself to the side of the pool and climb out.
You absolutely have to put the work in. The patient has to swim. That being said, when someone is like clinically depressed or anxious, it's like asking someone to swim that's got a broken arm, right? They could know how to swim. They could have people on the sidelines cheering them on. They could know what the destination is. They could be familiar with the water. But if their arm is broken, God damn it, they need some sort of device to allow them to put the work in. So just knowing what to do is not enough. And that comes back to like that first point. Usually people end up seeing me. So what's the road to seeing a psychiatrist? Typically, people, they try to solve their problems on their own, right? They usually realize my mood is off. It's been off for a while. Why is that happening? Why am I more like socially isolative? Why is my like ability to function professionally, socially, personally, negatively impacted? Why am I less interested in things? Why am I not as hopeful for the future? Why am I waking up and not wanting to like face my day?
Yeah, and I bet you probably a lot of people wait too long.
A lot of people wait. Some people never show up at all.
Yeah, I mean, I would go until I was basically dying, I think, before I would like personally try to like reach out for help.
A lot of people do. And a lot of people show up to me and my God, there's a lot of pieces to put together.
Yeah.
So usually this person will notice all these things I mentioned, and they'll talk to someone. Maybe it's a primary care doctor. Maybe they'll go to a therapist. If someone is stubborn, and for maybe not stubborn, or just doesn't actually like have the impetus within themselves to go seek care, usually those around him, their loved ones, will encourage, or sometimes demand.
Yeah.
Because when someone's down, it affects more than just them. It affects the loved ones, everyone that relies on them.
100%.
So usually they'll start with the primary care doctor. Usually they'll start with a therapist. I mean, seeing a psychiatrist, unless you're going for an illness that requires psychiatric medication, bipolar, schizophrenia, and many others, usually they'll talk to a talk therapist. Usually they'll talk things out. They'll come up with a behavioral plan. They'll work out like prior traumas. They'll make connections. They'll gain some insight. They'll put a plan forth. Now, the patients that come to me are the ones that, with this plan and insight and all the rest of it and this support, if they are not feeling better, if their progress is too slow, if they're not progressing in the way a therapist feels like is appropriate, if there's a question as far as diagnoses or whatever, if that is inadequate, they get sent up to a psychiatrist like me.
So you're like taking very sort of acute, direct actions, because this is a person who, fell in the pool, hit their arm off the bottom and broke it. And now they've surfaced and everyone's calling to them to swim to the side, and they've been doing it for a while, and now their head is starting to go under. Now they're like, oh shit, I'm drowning. Enter the psychiatrist.
Yeah. And I'm usually like the last line as far as outpatient care. So what does outpatient care mean? That means you sleep at home at night, you go to the doctor's office, you go back home. So I am an outpatient psychiatrist. I'm in my office from 8 to 6, 8 to 5. And I'm an outpatient provider. So I am that kind of final step as far as outpatient provider. What's after outpatient for patients that I can't get better quick enough or are in too much risk to be just seeing me? Now we send them up to a hospital. We send them to a residential facility, someplace where they actually have much, much more care, supervision, a bigger team, and sometimes even like sleeping in the facility.
Yeah, that's like really, really last line of defense, it seems like. I mean, where do you go after that? Is there anywhere to go after that?
Inpatient, a psychiatric ward is a last line of defense for those that are a danger to themselves or others. And let's say they're not a danger to themselves or others, then it's residential care. So both of these environments, you actually sleep in the hospital, in the residential care facility. So that's kind of our last line of defense. Yeah.
I think maybe we should take a minute to talk about the other part of the beginning of this conversation, which is the modern day stresses on people and how do people get here? What's going on with people that, because life in a lot of ways is the easiest it's ever been for us, but mentally it's getting weird.
Yeah.
So what are these pressures that are weighing down on people a lot nowadays, specifically nowadays,
Yeah. And when you say nowadays, are we talking about the past 10 years?
Yeah, I'm talking about more modern times. I mean, obviously we've been a modern society for a while, but it seems like there's been an uptick in mental health illnesses. I mean, especially since COVID, but more recently, maybe since social media or something, but definitely more recent times, 10, 15, 20 years.
Yeah.
There's definitely been, I feel like there's been a climb.
Well, you feel it because it's true and the statistics prove it. I don't know if anyone watching has read Jonathan Haidt's new book, The Anxious Generation, but he clearly outlines the data pointing to the increase of mental illness across age groups, more so in the Gen Z, millennial plus group. And I think if you took a survey of 100 people, what is the biggest modern force that is negatively impacting people's health? They will tell you social media, and not just the fact that social media is being mobilized into the cell phone that's being carried with you everywhere. That's not a secret. Again, you ask 100 people outside, probably 90 plus will tell you the same answer.
Yeah, no, there's really no escape. You know, I was working recently with a tutoring center, and they were telling me that many of their students, so they're starting like a homeschooling style program, and they were telling me many of their students have came to them. They were public or private school kids, and now their parents have brought them over to public school because of teasing. And it's interesting because I'm sure they're not getting the shit kicked out of them. I'm sure they're not getting beaten up, but they're getting teased, you know, verbally and whatever else. And the thing that's different from when we were kids is they can't get away from it. You know, we left, you know, when we teased each other in school or whatever, we'd go home and that was it. We were home with our parents, with my grandma, whatever, and we're safe. But these kids, they look on their phone, it's still there. You know, they're still, and it's even worse. Online, you know, it could be even more brutal.
Absolutely.
And so there's no escape from it, right?
Absolutely. And I begs the question, what percentage of this teasing was online and what percentage of it was in person?
I would bet it's more online.
Yeah.
Because people are always more, you know, they're getting more crazy online when it's not face to face. You don't have to worry about getting hit or something.
Well, of course. I mean, you make criticizing, or if you make unleashing that kind of like mean side of you anonymous and without consequence, and without you seeing the results of your damage in person,
you don't get to feel the guilt either.
Yeah. And guilt, we should talk about guilt. But yeah, I mean, if you make it this anonymous, consequenceless attack in which you don't see the damage you've caused in person and thus feel the guilt. I mean, who are people to damage people without feeling guilt? These are sociopaths, right? I mean, it can make an everyday normal person behave in like this like sociopathic way.
It actually
online.
Yeah. It puts you into a sociopath's box, even though you may not be one. It's probably terrible for you too.
And I'll ask you about what you mean by that in a second, but like, what is a sociopath? Like, what are some hallmark features of that? It's the inability to empathize with someone, occupy their point of view. And it's a lot of people that are sociopaths that are like absent of guilt. So it is much easier to act in like this sociopathic manner when you're in an anonymous kind of online setting. And I mean, this could be a whole conversation. I don't know if we want to go too much deeper in this, but you know, there's also, when you tease someone in your tribe and in your community, there's more at play as far as like the tribe, the community, your parents, their parents, the other kids in the class. I mean, humans are pro-social tribal animals. And if one of the members of this tribe is acting in a way that's not like contributing positively to the tribe, that it's not just that individual that who knows if they're passive, they're beaten down, they're discouraged, but the tribe also helps kind of defend this individual. So you've also kind of plucked this person out of his like protective tribe and just put him isolated online where there's no protection at all, no consequences. It's fucking pathological, right?
Yeah.
It's bad.
What would you say a good balance to strike is? You know, we can call this a quick fire question, if you will, but like proper balance to strike between living your life outside of the screen, right? And physically and mentally feeling all the consequences of your actions as much as possible. And then just living your life on screen, because we all know that that's at least a little bit necessary. Like there's no getting away from it. We are, and our kids are going to have to spend some time on screens online.
Yeah. Well, I think clearly the vast majority of one's social interaction, meaningful social interaction, should be in person. Now there's other sort of like, for instance, FaceTime is great, right? You're seeing the other person's face. Like I think FaceTime is like one of the only like pieces of technology as far as like social media and communication digitally that I'm a fan of. That's fine. Wonderful.
Still not
great.
as good as in person though, right?
Yeah,
but it's pretty good.
Interacting with anonymous people in which there's no consequences to their behaviors, I'm just not a fan of it.
Yeah.
I struggle to see, I struggle to see the benefit. I mean, let's turn it around. Let's say it's just constant validation. I don't think having constant validation from anonymous people online is healthy for you anyway.
Oh, you can
so
see
take
that
the other
with,
side of that coin in an extreme way. I'm not for that either.
Yeah, you can see that with influencers that are like destroying their lives, their home lives or whatever else for some more likes online and literally going insane in real time in front of everybody.
Mm-hmm.
You know?
Oh my God. Yeah. And I mean, that's another problem as far as like excessive seeking of validation online for someone to feel like they are worthy of like respect or admiration or complete. I mean, this will then kind of link into like a whole talk on self-esteem.
Self-esteem, probably trauma and all
Yes.
those things, right?
I mean, take self-esteem. One of, what I see in my practice, my specialty is mood, everything that falls under that umbrella, bipolar, depression, everything under the category of mood. Another umbrella is anxiety, different system than mood.
Separate. You're so it's categorized under the different pathways in the brain. I mean, that makes sense.
Yes,
yeah,
exactly. So we have mood disorders, we have anxiety disorders, obsessive compulsive disorder being at an extreme end of the spectrum, generalized anxiety disorder, social anxiety disorder, health anxiety. So we have the mood disorders, we have the anxiety disorders, trauma, and ADHD. So those are kind of my 4 niche expertise.
That's interesting. I would have thought ADHD was under anxiety. It seems like it is, but I guess technically it's not.
And there's total overlap between them. We can talk about that.
We'll get to that, yeah.
And then just to finish the point, so self-esteem, I mean, that's not one of these categories, but self-esteem in general, I mean, that building healthy self-esteem is also one of kind of my passions. And something that I've studied and something I work on every single day with patients.
In my opinion, that's one of the things you're best at, building healthy self-esteem in yourself and in your friends, family, the people around you. You've always been particularly good out of all my friends I've known at self-esteem, building healthy self-esteem. And one of the things that I've noticed is that self-esteem is not a selfish act.
No.
Right? You're not just building your own self-esteem at my expense. You raise me up and grow your own self-esteem as a result. Yeah.
And I thank you for that compliment. And I will say, I've been working on it my entire life, not just, in a systematic way. I mean, studying the greats, Nathaniel Branden, who I consider to be the father of self-esteem, but treating it as a science of its own, breaking it down. I don't know if you want me to go into a little bit of a spiel about self-esteem.
Absolutely. Yeah. No, let's talk about it because I think it's super interesting. It's something that everybody can do. Everybody can work on. It's a foundation for you to build your life off of outside of whatever other ailments you may have. And it's rewarding when you start seeing results from working on it. So I feel like it's very motivating, to any particular person who's working on their self-esteem. It's just that you have to be conscious of what exactly is self-esteem and how do you build it.
Absolutely.
And like being mindful about your own self-esteem. Oh, if I really want to, do this certain action that's going to diminish my own self-respect or diminish the gains I've made towards my own self-control. And I'm just going to break this for a day. And I know it's wrong. And I know it's going to have a negative impact on my mental health, but I really want to do it. So I'm just going to do it. And it's like, you're not giving enough weight to the importance of really sticking with your principles that you've defined yourself.
Bingo.
That build up your own self-esteem and like really just recognizing that, no, it's important. The self-esteem thing is important. And I should stick to it and continue to grow and not let these whims dictate what I'm doing.
Yes. And I should pass a compliment back to Jeff. Now, me and Jeff, I mean, we're somewhat birds of a feather. We've grown up together since we were 5 years old. We've both had a distinct interest in this, and I can't count how many conversations we've had about self-esteem.
Yeah.
So, I mean, I would agree with literally everything you said. Now, how important and how crucial and vital is having healthy self-esteem? I think it'll become more clear once we define it. So, I mean, if you're watching at home, I'm going to ask you a question. I want you to pause it after I ask you and just kind of give an answer before you resume it.
Yeah. And by the way, leave your answer in the comments.
Leave your answer in the comments. What is your definition of self-esteem? What does that mean? I mean, we throw that word around all the time, but what is your definition of self-esteem?
Yeah. And it can't just be simply feeling good about yourself. It's too vague. It's too broad, right? Specific things you can take action on.
Yes. Now, I'm going to come back to that word action. So, okay, let's assume everyone just resumed. So, self-esteem. Now, I subscribe to Nathaniel Branden's definition.
6 pillars, right?
6 pillars of self-esteem, if anybody wants to read that. Now, self-esteem is divided into 2 main branches. One, self-efficacy, meaning given some task, I feel like I am able to learn the steps necessary to accomplish that task successfully. That's one arm out of 2. Second arm, self-respect. I feel like I am worthy of having a good life and good things happening to me. So what is the overarching definition is I feel like I'm worth a good life and that I am capable of handling life's challenges. Now, is there anything more important to that for like literally everything? I mean, mood, anxiety, just being a human being, relating to others.
Probably not. And those aren't easy. Let's be clear about this. To actually, to truthfully on a deep level, feel like you can attack life's challenges properly and you rise to the occasion is not an easy task. Everybody, when they start any venture in life, will immediately learn that it's a lot harder than you thought it was going to be. You're probably going to fail at a few different things, right? That's normal.
Unquestionably.
And you work on building up the real world skills to allow yourself to perform as well as you would hope you would. As you thought you would when you started this venture, you know.
Absolutely. And let me kind of pick you up on a couple things you said. Now, if you guys want more on self-esteem, you can let us know in the comments. I mean, we could talk 2 hours just about that. But a couple things that Jeff said. So, one, it's not enough to just learn about self-esteem. There's a call to action. Now, I have patients come to me all the time like, Doc, I'm working on this in therapy. I'm like, yeah, but what actions, how has your behavior changed? A lot of them can't give me an answer. So it's not enough to learn. You need to act. Chapter 2 in his book is called A Call to Action, right? Another thing you said, right? Integrity. Having your behavior being congruent with your values, like what you were saying. So if we talk about the actions that help build healthy self-esteem, having your behavior being congruent with your values is incredibly important. So what's like one example, easy example? Let's say you really, really value loyalty and fidelity to your spouse, right? Now, let's say you've been engaging in like some sort of infidelity with your spouse, whether you're flirtatious with some woman at work, whatever.
Yeah, so it doesn't even necessarily have to be actually cheating on your spouse. It could be entertaining a little bit of flirty conversation with a coworker, and if that disrupts your morals, that counts. That counts to you because you care about that.
All that matters is that it counts to you and your values. Now, every time your behavior is incongruent with your values, your self-respect is going to suffer. Would you want to be friends with someone that is behaving like you, right? Now, people ask me all the time, like, Dr. Mike, do you judge your patients in the session? And I give them an answer. I'm like, listen, I will sometimes judge them based on their own values, right? We align their compass.
Yeah.
And if they're acting incongruent with their own stated values, goddamn right we do.
They need to know that.
Yeah.
Maybe they don't notice they're doing it. They need to know.
Yeah. Now call me. I mean, are there other providers and psychiatrists and psychologists that will never pass judgment? Yeah. I mean,
well, that's obviously just not being real.
And I have a particular style. I mean, the way I was trained, now you assess every patient for how fragile they are, the fragility of their ego. It's probably too much. Maybe we'll talk about that if you're interested.
Just to make it quick, you know.
Yeah, but my style and the way I was trained has to do with pressure and challenge. Now, again, there's a whole systematic way in which I assess the fragility of someone's ego, how much pressure and challenge they can take. And it's a very measured approach as to how much I push and how much I challenge. But to me, that has to be done for growth.
Agreed. And that just comes down to your discretion, right? That's what makes you you. That's what makes you so good at your job, is that you're taking your own judgment into account in knowing how far to push someone, or, you know, reading them as they react to it, knowing when to back off, knowing when to push harder, right?
Absolutely.
That's where the real like skill of it comes in.
It's a science. Yeah. Literally, I've been trained how to do that.
Is it also not only a science, but just a human, like an empathy thing, right?
Absolutely.
Yeah. Like you couldn't do it if you were an empathic person. Like
absolutely.
You have to like.
And the beauty about my job is exactly what you just said, just as being an empathetic human. If I had a case example and I laid out for you the conversation and what cues I took that I couldn't push this person, you would be like, yeah, I totally pick up on that.
Yeah.
That's exactly right.
Yeah.
I just have a system and a method and like fancy language about it. But that's the beauty of the job. That's what, I mean, I must say, I feel like I have the best job in the world. It's that everyone can kind of relate to what I'm doing because we do it every day. We are relational animals. We are humans. We're relating, you know, so, and that's what makes this conversation, I'm sure, like interesting for a lot of people to listen to because it serves everyone. We are social animals. So it serves everyone to have an understanding about other people and themselves. And
increase their adeptness, if that's a word, at social,
absolutely,
you know, gatherings and whatever else, you know.
Bingo.
Yeah. So I think maybe we should turn the conversation towards our planned, you know, questions and attacks. Maybe we'll give the listeners a little bit of value on more specific topics.
Sure.
You know, we have a lot of prevalent topics or prevalent ailments for people nowadays. As previously discussed, we have, you know, mood disorders, we have anxiety, we have ADHD, and we have trauma, right?
And a bunch of other stuff, but those I would say are my expertise.
Well, as broad categories, right? Let's start with the first one, and let's just have a little discussion about what exactly they are, how you go about. Well, I guess how you go about diagnosing them in the first place a little bit, maybe, and then fixing them.
Yeah.
So the first one we wanted to discuss. Let's take a second. I feel like anxiety is the big one. Maybe we should start with anxiety.
Yeah. So if one of your questions is how you diagnose, I suppose let me answer that first, and then we'll get into the classes of diagnoses like anxiety.
Sure.
So people show up. You know, I have a little intro call with them before, make sure they're appropriate for my clinic. I send them some intake paperwork, their history, what meds, blah, blah, blah. They send it in, they show up, right? So the last thing I do in a visit is ask them, what's the problem you're here to address? The first thing I do, you know, you talk about their meds, their medical problems, any allergies, family history of mental illness, who's your therapist, you know, these types of things. The next thing I do is I get a full social history. Now, this is something I kind of developed. I mean, I'm sure a lot of other people do it. It wasn't the way it was taught in residency, though. I get a full social history. Where are you from? Where did you grow up? Any siblings? Were your parents together, split up? Was it a safe environment to grow up in? Talk to me about like your life story. I want to get to know this person before I get to know what illness they're here to treat.
They might not even be right about what illness they have, right?
They might not be right, but let me, and this is actually like a therapeutic kind of tool I have, is let me defuse the person and their suffering. So they don't even realize that I'm doing this on purpose, but it's part of defusing. You are not your suffering, right? Let me get to know you, and then we can talk about this suffering and this mental illness that is not you, right? It's
Yeah.
something that you're experiencing.
How could the way you grew up, your life and your family and your friends and everything, how could that not be important? It's obviously.
Anyone that tells you it's not has no idea what they're talking about.
I mean, it just seems so obvious, but there are good psychiatrists out there that recognize these things, people. Okay.
There are. There's a ton of good psychiatrists out there, but there's a lot of people that, like any job, the good ones are the ones that have a passion, that have a drive, and that care. You pick any job in the world, I don't care if it's a doctor or what, there's a lot of people that don't prioritize their job. They're not so interested anymore. They clock in, they get their paycheck, and they go home. But there's also ones that are deeply passionate and they care. And thank God I fall under that category. I mean, I don't think I'd be here talking to you if I didn't.
No. Yeah. It's okay. So getting back to diagnosing, right?
Yeah. So I have a system, right? Now, this way of approaching it, I picked up through my training with like intensive short-term dynamic psychotherapy, a little niche. But it's a type of psychodynamic therapy that relies on pressure, challenge, and to get results quickly, right? And fundamental in this type of therapy is finding out ways how people are defending themselves against their own feelings and defending themselves against their reality, right? So I always start by asking, what problem are you here to address, right? What sort of problem are you having? Now, that maybe I shouldn't have brought this up right now, but that ISTDP formulation as far as like defenses, let's put a pin in that and come back to that so I can fully answer your question.
Can I ask you a question real quick?
Absolutely.
Would it be safe to say that mental illness is an incongruency between the real world and the reality of your life and your perception of it?
Yes, I would say what is vital to someone feeling well, it's being in touch with reality, responding to feedback from reality, being in touch with their feelings, allowing those feelings to drive them in their decision making and their behavior, and also, with regards to defending and not being in touch with reality, being in touch with other people, being emotionally close, giving feedback and responding to feedback. So being in touch with your own feelings, being in touch with other people,
recognizing,
and being in touch with the world and responding accordingly. Yeah. That is what's necessary to feel well.
Yeah.
Yes.
And recognizing other people have all those same issues too. Maybe be a little forgiving sometimes. And
being able to empathize, mentalizing, occupying somebody else's point of view. So what does mentalizing mean? It means occupying somebody else's point of view. Who are they? What's their history? How are they doing today? What part of their point of view is driving them to make that conclusion? This is what we call mentalization, empathizing, occupying someone's point of view. Now, let me quiz you. In what two disorders or classes of patients is the ability to mentalize deficient? What would you think?
Psychopathy, probably.
Sociopathic people. Yes, like we discussed before, the sociopaths, they don't feel guilt and they don't empathize because they have a difficult time mentalizing with the other person. This is a human with his own story. What's he think? How's he feel? Sociopaths?
Maybe the second one, I'm totally guessing here, but depression. The reason I say that is because when you're too depressed, you literally cannot handle you can't handle external stimuli. So you're just shut off from other people's problems, from anything else. Anything that's inconveniencing you is a bother. And so it's kind of, another path into just being completely closed off to any sort of, empathy for other people.
I would say yes. I would say anyone that is severely mentally ill with anything could fall under that category where they're so kind of functionally disabled
Yeah.
and socially functionally disabled, that the ability to do that temporarily is diminished. Now, with my question, I would say it's kind of wired into them.
Oh, yeah. It's not temporary.
So we have sociopaths. Should I give you the answer?
Yeah, I have no clue.
Autistic people. People on the autism
Oh,
spectrum.
that makes sense.
Yes.
Yeah.
Not there might be other things that I'm missing, but mentalization. Now, I've digressed pretty far. So back to the diagnosis, right? So what problem are you here to address? We break it down, right? We attend to that first problem. After that, there's certain checklists I go through, right? How's your sleep? Self-care, diet, exercise, water, sunlight, sleep hygiene, substance abuse, alcohol, cannabis, any other drugs. Then we talk about mood. We talk about anxiety. We go through a trauma history. And if they're there, and depending on whatever their chief complaint is, we dive further in there. ADHD, bipolar, schizophrenia, whatever. But this is called holistic care, right? We talk about everything.
Well, I think we should make a point to mention that it is holistic care. So let no one be confused about this, right? You are definitely checking on sleep, diet, the standard holistic things outside of pharmaceuticals. Like these things need to be in check, or you're going to help your patients get them in check, right? Before you just start, I saw a funny, we might cut this out maybe, who knows, but I saw a funny Instagram post. It was this lady pretending to be a modern doctor, right? Just talking shit. And she's talking to a lady and she goes, my trash can in my kitchen is really starting to smell. And the lady's like, oh, that's fine. I'm just going to prescribe you some air fresheners.
Yes.
All right.
Bingo.
Yeah. It's like, how about you take your fucking trash out?
Yes. Exactly.
Yeah.
Okay. I mean, if you're smoking pot every night, you're having a couple tequilas, you're going to bed at 12:30, you had a late caffeine, you feel like you're getting sleep, you wake up, you're eating shit, you're having chips, you're drinking a soda, you're barely getting sunlight,
Barely
you're
exercising.
sedentary.
Yeah.
Okay, you're going to get mentally ill. You're probably going to be depressed. At that point, I don't need to dig into your childhood necessarily, okay?
Yeah.
Now, let's get things straightened out like the basics, and let's see how you do. Now, if we're unable to get that in line, then the next question is why is this patient unable to help himself? What's the self-defeating side of him? But yes, step one is just get someone physically not sick.
Yeah.
I don't need you to be a marathon runner or Mr. Olympia. Why don't we just pull out all the poison?
Yeah.
Let's stop poisoning ourselves first. Drink some water, eat real food, get 7 to 9 hours of sleep overnight, get some goddamn sunlight, and get your body moving. And let's see where the chips fall, right?
I mean, that's your baseline.
Yeah. People don't realize how much
baseline.
of an impact that these obvious things have on their mental health. It doesn't always need to be some deep spiritual, traumatic, deep psychological Freudian. Let's get the basics in check and let's see how you do.
And
okay?
I heavily suspect that a lot of the problems with the general populace going on nowadays are just that. It doesn't have to be some deep-seated trauma. It could just literally be a couple, hopefully, if you're one of the lucky ones, it's just a couple corrections that are simple but difficult to execute, like building in the discipline to actually eat proper food, sleep right, get some sun, whatever else. If that can get you out of the pool that you were drowning in, that's a win.
Yeah. Take the weights off your arms when you're swimming.
Yeah.
Now, the astute listeners are going to think, well, hopefully all these conversations were had with the therapist, right? So I said people come to me when all of these things have been addressed, but shockingly, they're missed.
Not the case.
Now, I will say a good proportion of my patients, maybe one or two things are off, right? Maybe they're just smoking a little weed every night. Maybe they're having I mean, a big proportion of my patients are highly effective professionals in West Side of Los Angeles. They work their ass off all day. They come home. They've earned a couple drinks of alcohol. And maybe they'll get to exercising, maybe not. And maybe they have a little bit of a late espresso. I mean, honestly, just cleaning up the booze, unfortunately, no amount of alcohol is good for you. I mean,
it's a damn shame, really.
maybe spiritually when we're, the boys are together. And I'm not
I'm
not here to vilify alcohol, right?
Yeah.
But any sort of habitual use, unfortunately, not good.
Yeah.
And maybe we just pull off a couple things. We teach them about sleep hygiene, no caffeine, 10 hours within bedtime. Sleep. I always start with sleep. Sleep is the foundation for literally everything, right?
Yeah.
Now, you're a science-minded, evolutionary guy, right? How important is sleep, right? So humans have been evolving over how many millions of years, right? Now, when we're asleep, we can't look for food. We can't mate. We can't be on the defense for predators.
Literally can't do anything.
Yeah.
That's how important it is.
We're totally vulnerable. And yet over all of these years, it is still evolved that we need 8 hours of sleep. Look at the cost of this.
It is a huge cost.
And yet a third of our life, we still need it. That just goes to show you how important and vital it is. 99% of people need 7 to 9 hours of sleep. And the other 1%, it's like genetic, right?
Yeah.
And you cannot train yourself to be one of those people.
No.
This is not my opinion. It's the sleep science.
Yeah.
Yeah.
Yeah. You need it.
Yeah.
Need it. And substance abuse eats into your sleep. You could sleep the whole time, but your sleep's going to suck. You're not going to recover as much. You're just taking a little bit off your life every day, a little bit off of your mental health every day.
Exactly. Yeah. Hey, doc, I get to sleep just fine after a couple of drinks. Hey, doc, I had an espresso at 6 p.m. Yeah, you might be asleep, but the architecture of your sleep has been negatively impacted and compromised, and you might not be as well rested the next morning
as you think you are.
And compromised sleep over months, years, it comes at a heavy price.
Years.
Yeah.
Yeah. Mother Nature didn't design you to be able to slam a couple glasses of wine or some shots, smoke a little bit of a joint, drink coffee a little bit beforehand and go to sleep. That's not how you were designed.
No, unfortunately not.
It's a shame, but
yeah, it's a shame. Now, so, any more questions? Did I kind of answer the question as far as like how I diagnose people?
Yeah.
And then we could get, if we want to get more specific as far as anxiety disorders, I don't know if that'll get too specific. I'll let you lead the dance. But that's kind of like the general flow. And those watching, I mean, if you guys are more interested in like that defense specific question, pressure challenge, how do people defend? Maybe leave some comments. We'll make another video about that. But that's kind of like the general flow.
Cool. Let's take a moment and pause and see where we should pick up, because we
Sounds
did have
great.
some things. I don't think we've gotten too into like the actual things we had discussed
Sounds
earlier,
great.
right?
Absolutely.
Okay, so we're resuming now.
Mm-hmm.
I have a close family member who's had the same problems for a long time, and he recently backed out of going to your wedding because of social anxiety, right?
Mm-hmm.
And I'm an uninformed member of the public, let's say, this isn't my expertise, but my gut instinct was to be like, why has this therapist had them focused on their problems so much, allowing them to make excuses because of their problems, and it had them on medication for a long period of time and hasn't been pushing them to partake in their life as they should, So, and that kind of coincides with what we were talking about with your pressuring. What was it? What
Pressure, challenge.
Pressure challenge.
Of course.
Yeah.
Yeah. This is a great point, and I hear it. So if I have a patient, let's say your friend is my patient, I will often hear from family members as far as, well, why aren't we need to push them, right? Now, the question is how hard to push. Now, when you're dealing with anxiety, for instance, social anxiety. So what is social anxiety? Social anxiety. Yeah, I suppose if everybody wants to like take a time and guess what their definition of social anxiety is, because I hear that tossed around all the time.
Yeah, leave it in the comments.
Social anxiety. What is your definition, guys? Now, with all clinical anxiety disorders, we are overestimating the chances of a negative outcome, and we're overestimating the severity of the consequences of this negative outcome. So what is social anxiety? In social anxiety, we are overestimating the chances of being negatively evaluated by other people.
Does that manifest in embarrassment?
It can.
Ruminating on your own shame?
It absolutely can. It can. Yes, I'll tell you what a result of that is.
I should just kill myself because
God
damn it, you know.
Hopefully not, but I'll get to the embarrassment and shame. We could talk all about shame too, and guilt like we were bringing up before. So social anxiety, we're totally overestimating the chances of being negatively evaluated by other people, and we're totally overestimating the severity of the consequences. Oh my God, for sure, these people are going to think I'm weird. They're going to think I'm weird, and the consequences are going to be horrible. They're going to talk about me. Everyone else is going to think I'm weird. I'm going to feel like total shit. My mood is going to suffer for the next 2 weeks. I won't be able to recover from this. Yeah. I'm going to be thinking about this for forever.
And the pernicious thing about that is that the next time you go and hang out with those people, you're going to infer all sorts of like behind the scenes connotations of the way they're looking at you and treating you and stuff that just aren't true. You know, you're going to be like, oh, they secretly hate me. They secretly think I'm a joke. You know? And that look they give you, you're going to infer it as some sort of like negative thing. And in reality, they're like, don't care at all.
Bingo.
You know, maybe they had some gas and that's why they made that face or something, you know.
You're hitting on the exact right point. Again, like we were discussing earlier, everything you're saying is exactly what we work on, except in a scientific, systematic way. So you have this socially anxious person. I feel like if I go to this wedding, for sure, people are going to think I'm weird, and the consequences of that are going to be horrible, right? Now, we're not telling you that there's 0% chance that people are going to think you're weird and it's not going to be good for you. What we're saying is you're overestimating by far the chances of this horrible outcome. So one, yeah, it might happen. And two, yeah, it might be bad, but you're totally overestimating it.
And just for everyone out there, it happens to all of us.
It does.
I can't tell you how many times I've made a fool of myself, but he's still my friend.
Absolutely.
It's okay.
I've been very generous with this guy over here, actually. And people talk behind his back all the time.
Let's not make this one-sided, you know.
Now, to your point, right, to your question. So should this therapist be supporting avoidance behavior, right?
Yes.
So what does social anxiety, how do we defend against this risk of pain? Avoidance, right? We don't go to the wedding. We don't go to the party. We don't go to the family Thanksgiving.
You're avoiding your whole life.
Yeah. Well,
you know, maybe.
A lot of life is social. Mm-hmm. Yes, we're social animals. Now, to get to your point, so in with cognitive behavioral therapy, for instance, right? If someone is socially anxious, we want to expose them to their fear in a systematic way in which they have to utilize courage, but we don't want to flood them with fear so they have a panic attack. Now, if going to the wedding is like 9 or 10 scary, like 9 out of 10 or 10 out of 10 scary, we don't encourage them to do that because flooding yourself with fear is actually counterproductive.
Right. If something happens, well, now you got something else to be afraid of.
Yeah. And it can be traumatizing and it can be, again, counterproductive. So who knows? Let's say going to my wedding. Now all my patients know I'm getting married. Well, at least the ones that are watching. Again, more self-disclosure here than in visits. Maybe it was right of the therapist to support them not going.
Right. Now, okay. Yeah. So I shouldn't have made assumptions like that. Right. I'm talking out my ass. I'm voicing my own frustrations about the situation.
Exactly. And
I ain't a professional at this. All right.
And that's the role I take. It's one of more compassion because, again, the 90% of people will have the feeling you have, like, Why is this therapist telling him to avoid the wedding? He should go. It'll be good to him. He should face his fears. But yes.
We don't know what's actually going on.
And who knows? This might bring upon panic, and this might be like a 10 out of 10 in fear. So when we want to attack social anxiety in a CBT, cognitive behavioral therapy approach, we have them come up with a list of things that's called the fear hierarchy, and we want them to go knock out stuff that's like a 4 out of 10. Stuff that'll bring a rise, require courage, but won't put them in panic. What you were saying before, as far as they're assuming people are like, you're looking at them sideways, part of so before they go into this exposure, 4 out of 10, we have them list what is objective evidence that your fear has come true, that these people think you're weird. And then what is your subjective interpretation? We don't want to count on that. Just because you feel like that guy thinks I'm weird, that is not evidence that your fear came true.
Yeah, there needs to be some actions that
What
happened.
is objective evidence?
Yeah.
Now, that's the basis behind treating social anxiety in a therapy way, a CBT way. What is 4 out of 10 scary? What's subjective interpretation that things are going wrong? What's objective evidence? Go do a bunch of times, come back. And what you see over time is that their fear gets extinguished. Something that used to be a 4 out of 10, doc, it's like a 2 out of 10, no problem. And you work your way up, and perhaps you can finally culminate with going to a wedding in which, God, a lot of people are there. You have to be well dressed. There's a certain decorum and etiquette. So who knows?
Yeah.
This friend of yours, maybe the wedding is a 4 out of 10, and the therapist is just being too supportive and not challenging and pressuring them enough. But who knows? If it's too much, they might be making the right decision.
It could be a 9 out of 10. That could be wrong, right? Like my own subjective view of it is it's no big deal. I love weddings, but
exactly,
it's a whole different game.
Exactly.
For someone who has a problem with those kinds of things.
Yeah, and let's mentalize this person. He's been to 3 weddings before. He didn't know how to dress. People looked at him weird. He didn't know how to interact with people. He left home. He felt embarrassed and ashamed. He led to him to be like mildly depressed for 3 weeks. It's happened over and over again, right?
Yeah,
so if we occupy
how
his
close
point
are the
of
weddings? This is his 4th wedding in 2 months. That's different than his 4th wedding in 5 years, you know?
Exactly.
Yeah.
So,
you know, and also it's got me thinking, you know, everybody's path is different, right? So our family expects you to be at the wedding, right? If your family didn't expect you to be at the wedding, then it might not even be a concern that you're missing it. It might be no big deal, right? But like every person has their external life, right? Their family or their friends or whoever else that expect certain things out of them. Their tribe. And so I guess it's probably part of your protocol to figure out what exactly is their specific tribe and their life's struggles with their own pressures on them.
Absolutely.
And work them towards those specific things. You know, like for some people, wedding, no big deal. It's not a defined rubric for everyone where you're like, well, to get out of my to graduate into a healthy person out of my practice, you have to be able to go to a wedding. Like, no.
Absolutely.
Right.
What you're suggesting is absolutely right. You have to have a holistic view of this person. Who are they? What does their world look like? What sort of external pressures do they have on them? Who's their family? What's their tribe? Absolutely. I couldn't agree with you more.
Yeah. And this is a great segue into what we wanted to talk about with anxiety in the workplace, right?
Yes.
Anxiety in the workplace is apparently a very common thing, right?
Yes. I see it every day.
So what are some of the things you're seeing with that?
Well, maybe it'll be helpful if I give you like an example with a patient I saw recently, right?
Yeah.
They were fired from their last role. They're now here at the new role. And this is going to tie in self-esteem. And they're constantly anxious that they're not doing a good job at work, despite their feedback every like 6 months, and they get their bonus and their bosses are telling them that they do a good job.
They're going home and they're having nightmares about that everyone secretly hates them and all this.
They're being restless overnight. Yeah. They're feeling anxious throughout their work. They're second guessing their work. and they're asking for constant reassurance, right? So this is a good time to outline some, what can we learn from this? So this person's self-efficacy has been diminished by being fired at their last job.
Yeah, very real thing.
It's absolutely real. It's human, right? You get fired. Oh, was I not doing a good job? So their self-efficacy, their belief in themselves that I can accomplish this task successfully has been damaged. Now they're getting anxious about their work. They're worried that it's not high quality enough. They made a mistake. They're compulsively double checking their work, and I'll define compulsive later. And they're also compulsively, meaning they're anxious. And in the moment while they're anxious, to relieve that anxiety, they're compulsively asking other people for reassurance. Hey, am I doing a good job? Hey, is this right? Now, when we engage compulsively, it shows to other people that we're not secure and self-efficacious and sure of our work. So their self-esteem, their self-efficacy is low. They were just fired. They're getting anxious. They're asking for reassurance. They're double checking everything and things are getting delayed.
Yeah, now maybe their boss or their supervisor is like, well, this person is asking me a lot about if they're doing a good job or not. Maybe I need to look into this more and make sure they're actually doing a good job. And now you can maybe like interpret that as like, oh my God, my boss is on my ass now.
Exactly. They start manifesting their fears. That boss is thinking, if they're not confident in their work, should I be confident in their work?
Yeah, should I need to check on this?
Exactly. So now they are manifesting their fear.
It's coming to life.
Everyone now knows that they're not secure and confident in their work. Now they're double looking over their work even more. They're pointing out certain things. They're treating them with less respect and confidence. Now they're getting objective evidence that their fear is true. And now they've manifested this low self-efficacy, unsure of their work, and perhaps they get fired or they don't get the promotion. Meanwhile, this all started with them actually doing a good job and having positive feedback at work. And now they have manifested.
They've ruined it for themselves.
They've ruined it for themselves and they manifested it. So this low self-esteem and work anxiety has now manifested a position in which they get fired. They don't get promoted. People don't treat them like they're a good employee. They double check their work and the rest of it.
Do you ever find that this stuff manifests itself in substance abuse at some point? Like they go, I'm too anxious at work or whatever. I'm just going to drink.
Anything that causes distress can lead to self-medicating with substances to relieve that distress. In this example, it would be the work anxiety. Now, this patient actually was drinking alcohol throughout the day to try to relieve their anxiety. Of course, we addressed it. Now, here's one lesson. So one lesson with them, it has to do with everything we just talked about for this patient. They're getting anxious about their work despite objective evidence in the past that they're doing a good job. Anxiety is distressful. When we are feeling anxiously distressed and worried, we feel compelled to relieve that distress. One compulsive behavior to relieve this anxiety is asking for reassurance from others.
Which is more healthy than drinking, I guess.
Certainly.
It's the first step.
Now, what we talk about is sitting with that anxiety, not entertaining it and validating it to the point where it drives your behavior to seek reassurance. So we break that link of this anxiety that is not based in reality. Again, they were doing a good job to behavior of compulsively seeking reassurance.
Do you ever work with your patients to come up with some sort of backup plan? Speaking from personal experience.
What do you mean?
The reason why my anxiety is generally low when it comes to these sorts of things is because I've always thought, well, if I get fired, I'll go get another job. And I always have that in the back of my mind. So even if my boss is getting on my case or something, right? Like I'm still likely to stick up for myself because I'm willing to lose the job.
Yes.
Because I know that like even worst case scenario, if I get fired, I'll go, get a job somewhere else, right? Like, do you build that into the...
Excellent point, right? Absolutely. Now, if you have security, so here we're talking about a job and having the security of other options.
Yeah.
If you have the security of other options like plan B, contingency plans, whatever, then the stakes of not performing optimally are lower. If you don't have any other opportunities, then the stakes and the consequences for failure are higher. And when the stakes and consequences for failure are higher, then that is a bigger perceived threat and the anxiety is higher.
Do people ever really not have any other opportunities though?
Depends on the person, depends on the job. Hard to answer that question, but
I mean, I'm not saying they have to have a plan B lined up. I never have. All I'm saying is I guess you feel confident enough in yourself that you could land a plan B.
There comes the self-esteem again, right?
Yeah.
That self-efficacy. If I lose this, I'm sure I can take the steps necessary to get another job. So the self-confident person, yes. So here, by building their self-esteem, they don't even need to have the security of other job options. They can fall back on their self-esteem.
Yes, and they know they could do it if they really needed to.
But herein lies this person that is low self-esteem. So usually that feeds the anxiety. I don't know if I'll be able to find another job. Again, when the stakes of failure are higher, failure is a bigger threat. And what is anxiety? It's threat detection and worry, which feeds their anxiety. Excellent point.
So something I wanted to ask you about, slightly different topic maybe, but it got me thinking about people who drink on the job to get through the shift.
Yes.
Right? Like, I don't think it's exactly the same thing, but it is sort of the same actions.
Yes.
Right? You have someone who's going to their shift, drinking to get through the shift.
Yes.
What is that problem? Is that anxiety, or what is that? And does that have anything to do with what we were just talking about?
Yeah, so great question. It's my job to figure that out. What is driving the substance use? Is it to relieve the distress of feeling anxious? Is it to relieve the distress of boredom? What is there a distress you're trying to relieve with the substance? It doesn't have to be anxiety. It can be boredom or anything else. So I suppose that would be the question, is what is driving the substance use? Alcohol use, whatever.
And then you would attack that specific issue if it was something that needed
Let's
to be
break
solved.
it down. What's driving it?
Yeah.
Sometimes there's more than one answer, of course.
Totally.
Yes.
Totally.
Yeah.
Yeah.
And sometimes people just, again, it could just be a boredom. Let me just try to amplify this experience. I have to be there anyway.
Yeah.
Yes.
Yeah. I think that's the case for a lot of people too. You know?
Absolutely. Yes.
I guess that kind of leads us into impulsivity, right? Being in control over your actions, recognizing long-term benefits of consistent, well thought out actions and things like this. So I think you were telling me, correct me if I'm wrong, that a lot of people you see have problems with impulsivity, particularly people with ADHD.
Definitely.
So what's the deal with that?
Yeah. So, the audience is going to learn that I love definitions, right? So what is the definition of impulsivity? I mean, people can leave it in the comments. You could pause. Tell me what you guys think. Impulsivity. When someone has an urge, a desire, and they act on it behaviorally without enough time to consider future consequences or anything else. Urge, behavior, not enough time for consideration. That is on what we call impulsivity and acting on impulse. Now, you mentioned something. What is the definition? What is the antithesis of impulsivity? Well, let me clarify. So when someone impulsively seeks pleasurable things at the consequences of their future, that is when impulsivity becomes a problem. Being impulsive is not always a problem. It could lead to quick decision making, whatever. But pathological problematic impulsivity is when people are making decisions for pleasure or relief or whatever, gratification now at the cost of their future well-being or their future anything. The opposite of that is self-discipline. Sacrificing pleasure and wants and desires now in service of the greater good for your future. Here we have problematic and pathological impulsivity versus self-discipline. Now, what question, did you have a specific question as far as and impulsivity can be a hallmark feature in those with ADHD, but absolutely not confined to just the ADHD population.
Yeah. So let's talk about why would someone be subject to impulsivity? Why would they become a victim to it? As I understand it, it's a lack of foresight, right? It's hopelessness. It's not trusting in that your future is going to be good. So why save any resources for tomorrow? Tomorrow's probably going to suck. Why not just spend them all today?
Excellent point. Now, you can find impulsivity everywhere and in all sorts of people and patients. What you just said is an important point. Patients that are depressed and don't have much hope for the future, if the definition of impulsivity is seeking something pleasurable now at the cost of the future, if they don't really have much hope for the future, then they'll take that trade any day.
Any day.
So you often see people that are depressed and hopeless and don't care or even envision their future. They're not future oriented at all, can certainly be more impulsive because that trade-off is worth it. Or again, the consideration for future consequences in their future is not even present. Yeah. And that would lead to a whole other discussion we won't get into now as far as depressed patients and their lack of future orientation. In fact, when we're assessing risks of suicide, future orientation is a protective factor for people that are suicidal.
Yeah, it's something I dealt with myself. When I had a little depressive episode back when I was like in my mid to late 20s. And like the main issue I recognized was like, I couldn't even imagine a future that I would want to live.
Yes.
Any future I imagined, it would always just end in misery and suffering. And just, there's no point, and it's a lot of hard work and really learning to value the positive things in life and becoming sort of an optimist in a way to set a future for yourself that you say, yeah, I could live with that. That would be great. In fact, that would be a miracle.
Absolutely.
And then now you got something you can work towards.
Getting people future oriented, working on self-discipline and limiting impulsivity is absolutely a big thing that I work on every day with patients. And it's also about just, showing self-respect to you, your future, and your future life.
Yeah. And I think you were telling me earlier that there's a disconnect, it's a common pitfall, it's a common thing that people fall into, where they come to you and they say, Dr. Mike, I've been enjoying things are pleasurable, but I'm still feeling this way. Right. And you told me, yeah. You tell them like, yeah, pleasurable things don't necessarily mean they're good for you in the long term.
Bingo. Yes. Let's not conflate pleasure with happiness.
In fact, at least in my case, most times it's the opposite. It's discipline and grueling work, doing things for other people and doing things that other people find meaningful actually help you out.
Yes, I agree with you. We were discussing, I think what you're talking about is that case. I have a patient, chronically depressed, dysthymic.
What does dysthymic mean?
Dysthymic means you have some symptoms of depression over a long period of time. You are not in like a clinical major depression that's like disabling and functionally impacting you and I can't get out of bed. Your mood is low. You might be less future oriented. You might be less pleasure seeking as far as like things that you're interested in, not necessarily pleasurable things that are bad for you. But you're functional, you're getting up, you're going to work, you're seeing your friends, but you're just not feeling great. You're dysthymic. Some symptoms of depression for a long period of time.
Okay.
So this patient was dysthymic. He has intermittent episodes of depression. He's being managed on psychiatric medications. And he's like, Doc, what the hell? Like every weekend I'm going out, I'm having a pleasurable time. I'm with my friends. We're partying and the weekend's great and they're utilizing substances. Why am I been like low grade depressed for so long? And the point, the educational point here with this patient was just because something is pleasurable do not take that as feedback that it's guiding you to like sustained happiness. So just let me repeat that for those listening. It's an important point. Just because something is fun and pleasurable does not mean that that validates that it is good for you in seeking long-term wellness, happiness, and a sense of content.
Would you say even it's most times kind of the opposite, really?
Depends. I don't want to pathologize or vilify pleasure because there's all sorts of things that are pleasurable that are good for you and good for happiness and long-term wellness.
We're supposed to enjoy our lives sometimes, are we not?
Well, then what's the point of it?
Yeah,
right.
yeah.
Yes. So that's another important point is let's not vilify pleasure.
You said the term happiness.
Yes.
I'm wondering, would you be willing to substitute the term meaningfulness? Meaning.
Oftentimes, it's difficult to be happy without having meaning and purpose in one's life.
Because like taking a Petersonian approach to it, right? Mm-hmm. I think I agree with him too. Is the goal is not necessarily sustained happiness. It's a solid foundation of meaning that allows you to weather anything. Mm-hmm. And when you're happy, you really do enjoy the moment. You're present and you enjoy it for what it is. And you recognize that the feeling of happiness is fleeting and you get to experience it only so many times in your life and you come to appreciate it. But that like the main thing we should be striving for is meaning because it buttresses you against, all of the hurtful, negative things, sad things in life that inevitably hit all of us.
Yeah, I completely agree with you.
Yeah.
Now, let's see, there's a lot to talk about in just what you said. Hold on, I'm thinking you said something. I lost my train of thought.
Meaning versus happiness and because
okay,
I feel like the goal shouldn't be, I'm just talking on my ass, but I feel like the goal shouldn't be happiness. It should be meaning. And like when you, especially if you've been a depressed person or something and you experience real happiness, it really affects you and you go, oh, this is happiness. And then you really appreciate it and you go, no one can live like this forever. This is a fleeting high point that hopefully I experience as much as possible. But like, this is not what I should be striving for to live like this all the time. It's impossible.
That's an excellent point. So here we have to differentiate between the feeling and emotion of joy versus happiness. So it begs the question, what is the definition of happiness?
Yeah.
What does happiness mean? Joy is this feeling, this temporary physical state of elation, joy, pleasure. Clearly, if someone has a emotion of joy and happiness like that, they're probably hypomanic or manic.
Yeah.
So this begs the question, and patients ask me this all the time, how should I be feeling? What is the goal? What is happiness? What is the definition of happiness? Now, there's a million podcasts out there that are trying to define happiness, so maybe we won't spend too much time. But I don't know. What do you think? Like, what is your definition of? So clearly, your definition involves meaning.
Yeah, I think like we're having a semantic like argument because you're saying happiness and like I'm taking it as meaning.
Yes.
Like it's fulfillment, contentment, emboldening, and willing to continue on this arduous journey because you recognize that it's worth it.
Absolutely.
And then joy, as you would say, is a little sprinkle, is a little gift you get along the way every once in a while.
It's a feeling.
Yeah, it's a feeling.
It's a feeling, much like anger is a feeling.
It's very temporary.
Yes, just much like anger or disgust or shock. It's a feeling. Now, I would agree with you that what I tell patients is we want you to be reasonably content. You have your highs, you have your lows. They're proportionate to what's happening in your life. You have something in the future that you're building towards. You have meaning that goes outside of just yourself. You feel a sense of purpose. You feel like you're giving back to others. You feel like you have some sort of status in some sort of community. These are kind of the goals for how we want to feel. The things that you're discontent with, you have a level of hope and optimism for. But every person, a happy person or otherwise, they have their ups, they have their downs, they have their struggles, they have their sadness, they have their joy, they get angry, and all the rest of it.
And that's normal.
And that's a normal person.
We're people.
So that is what I would say is my definition of what is the goal for how we're supposed to be feeling.
So we agree on that.
Yes.
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 So do you, when you're dealing with certain patients, do you ever push them to, let me rephrase. You have someone who's ruminating. You have someone who's internally focused, thinking about their problems all the time, like we were talking about earlier, right?
Yes.
A lot of people, when you combine that with some sort of social anxiety or something, they're afraid to let people down. They're afraid to feel shame and all of these things. Like, can you utilize that to get them to step outside of themselves and start helping the people around them as an avenue towards their own betterment?
Yes. Easy answer there.
Yeah. So,
Totally.
so a good avenue to get out of some sort of depression spell or something like that could be to, understand your suffering, but maybe you'll let yourself down, but maybe you won't let someone else down as easily. And maybe you can get some sort of valuable, positive feedback from the universe when you help someone else. It lifts your soul a little bit, right?
Absolutely.
And maybe get out there and do some good for other people instead of focusing on yourself so much.
I think what you're saying is just an absolute fact. Giving back to others, contributing to other people it's almost a requisite for happiness.
Yeah.
Now, whatever community or tribe or group or whatever you're giving back to, I would say that's just, I'll say it again, a requisite for a meaningful, happy life. So oftentimes when patients are ruminative, they're too introspective, they're depressed, having them shift their attention outward onto others in a way to give back absolutely is part of the treatment plan to help them feel better. I get people to go volunteer places all the time. Yes. So I think you're dead on with that.
So when you're talking with people who are overcome by, I think it's their limbic system, right? They're overcome with anxiety or worry about doing any sort of specific task, getting out, walking out the front door and doing something, in public or whatever. Right. And you were telling me that what you try to do is basically remember that you have a prefrontal cortex.
Yes.
And try to inhibit your limbic system a bit.
Yes.
Try to rationalize yourself into taking proper actions, right? But rationalizing yourself into taking proper actions is extremely difficult, especially for people who are high impulsivity.
Yes.
Right?
Bingo.
How do you go about getting people to actually take the actions, in a pragmatic way, like for our audience, if they're having problems with impulsivity, if they just can't get off the couch, if doing something like tying your shoes is difficult for them, what are some ways that you help your patients just at least start to move the needle a bit?
Wow, what a phenomenal question. So first, let's kind of educate the audience. Your limbic system is kind of that deeper, older, like group of structures in your brain. That's the emotional, the part that springs out feelings and emotion, and importantly, fear. That is where your amygdala is. This is that fear center. So that emotional fear center, that's your limbic system. And your prefrontal cortex is what inhibits, puts the brakes, assesses risk, future consequences, and puts the brakes. So if I'm at work and my boss pisses me off and I get that anger kind of response and I want to punch him in the face, that prefrontal cortex is what tells me, hey, it's not worth it. You need this job. The risk is too high. There's going to be consequences. So your question is, how do we help patients that are acting out of emotion and fear get better control to operate with more reason and rational thought and logic That's your question.
Yeah, particularly people who have low control, who are too mired in their own anxiety or depression. I mean, for the general populace out there too, I'm sure this is beneficial to hear.
Mm-hmm.
But let's take it from like, a worst case scenario perspective.
Yes.
Somebody who like they're almost useless.
Yes.
And
here we really have to divvy it up. Is it this sadness and this depression and that overdrive that's, rendering them disabled? Is it a fear? Is it a patient with PTSD and their fear is overriding reason and rational thought? Is it? So I suppose we'd have to break it down even more specifically.
Well, is the treatment plan different?
Yes, absolutely.
It's not a generalized.
No, totally different.
Really?
100% different.
Okay.
The way you treat therapeutically is different. The medications you use are different. The plant completely different depending on what we're talking about.
Okay, so we have two main ones we just talked about. We have a depressive person and then an anxiety
Trauma.
Let's start with depressive.
Mm-hmm.
Let's try to keep it concise, and then we'll go to trauma. Same thing. Try to keep it concise, and then we'll move on with this.
And I will tell you, the easier question to answer is the trauma. The anxiety system is so much more well-defined, so much more cut and dry, and so much easier to discuss and formulate a treatment plan. Not necessarily easier to treat, but forming a plan is typically easier.
Okay.
Depression, my God, there's so many different systems. It's more sort of like nebulous, if I'm kind of mysterious sort of system, so much less well-defined. I mean, for instance, psychiatrically, what is a medication we oftentimes use for depression? There's serotonin reuptake inhibitors, SSRIs, Prozac, Zoloft, Lexapro, Celexa. Those make people feel less depressed because they boost the serotonin in your brain. But do we have any evidence that a lack of serotonin is found in depressed patients? No. We just know that taking it up
really
leads to them feeling less depressed.
So I actually had an argument with my wife this morning. She was telling me it hasn't been proven that these imbalances in the brain are a real thing. It was like one study. And I was like, no, that's total BS. I was wrong.
So I think the New York Times or something like 6 months ago, they republished a study that was already, every psychiatrist already knows this, that we don't even know that it hasn't even been proven that a lack of serotonin is leading to depression, and SSRIs are all bullshit, right?
Doesn't necessarily mean they're bullshit because we're taking a pragmatic approach. We know giving a person SSRIs helps, but we're not claiming.
Exactly.
Yeah.
It doesn't, just because boosting up serotonin relieves depressive symptoms does not mean that the lack of serotonin is what caused them to be depressed in the first place.
It's just a pragmatic approach. It's like, hey,
any psychiatrist that paid even a little bit of attention in residency knows that to be the case. So this was not some sort of, oh my God, it's overwhelming the psychiatric community. Yeah, we all know that.
Dude, good to know. I didn't know that.
Which is actually, so on that point, this is what is also leading to, there's a lot of studies and research out there to find different ways to treat depression outside of boosting serotonin. Insert ketamine, NMDA receptor antagonist,
or even
neuroplasticity, the rest of it. We don't have to get too much into ketamine today, but point being, it's kind of still a big mystery as to like what leads.
Or even exercise, right?
Yeah.
I've heard exercise is even good.
Yeah.
But that goes back to the other conversation we were having about getting your life right before you even start trying to.
Absolutely. Yeah. We could talk about what's going on chemically, neurotransmitter wise, physiologically that leads to the depressed person. We can also talk about, psychologically, spiritually, a lack of meaning, no sense of purpose, not much hope for the future, no good interpersonal relationships, not being in touch with their feelings, lack of being defended against letting other people in with them, not asserting themselves, low self-esteem. So we could talk two different ways as to what leads to depression That sort of psychological, spiritual realm, or the physiological one?
Well, would I be safe to say that if modern pharmaceuticals didn't exist, you would still have a job?
You would absolutely be safe to say that.
So I think probably the primary thing is all that stuff you just named with, I guess we can put that under the umbrella of lifestyle.
Holistic psychiatric care,
Yes.
lifestyle, self-esteem, relationships. I mean,
And now
the list goes on.
In the interest of optimization and pragmatism, we introduce these very powerful substances judiciously
Yes.
by a professional at the proper time, at the proper amount to
For the proper duration. Let's
the
get
proper
this guy
duration. Yeah.
the floaties he needs so he can swim.
Yeah.
And then let's take the floaties off.
Is it generally your opinion that eventually people should taper off like any psych meds besides like if maybe they're like schizophrenic or something like that?
Depends. Yeah. So let's talk about just like, okay, when we have patients that are bipolar, schizophrenic, that need lifelong medications like mood stabilizers, antipsychotics, let's put those aside for now.
Yeah.
So we'll talk about like the depressed, anxious
anxious
folks.
Maybe
Yeah.
ADD.
Well, maybe.
Okay.
Sometimes ADHD patients need long-term
We'll get to that.
medications. So it depends on what the patient's goals are. A lot of patients don't have the goal of getting off medications. Doc, this thing is life-changing. It's making me feel well. I feel capable to make meaningful change and growth and development. Fuck it. I don't want to get off. I feel great. No long-term side effects. I don't have a goal of getting off. So I suppose the point is I align myself with my patients and their goals regarding their medications. That being said, when I have a patient that's stable, has made meaningful change, has addressed these factors, has done exposure therapy, has put in the work and cured themselves, I will periodically ask whether or not they want to start reducing in the same way. So it would be wonderful for every patient's goal. Hey, doc, I'm willing to put all the work in. I want to start the meds and eventually get off. Those are highly motivated patients. And a lot of my patients, I consider it a good job when I get my patients off psychiatric medications and they never see me again, right?
Yeah.
That
Job
to
done.
me is
Yeah.
a success.
Mhm.
If they never have to come into my office again, I have succeeded.
Yeah. And to all the people out there saying, doctors and psychiatrists are running a racket trying to get as many people on pills as they can. I think the general public would do good to realize that there's too many sick people out there that one person could possibly help. So anytime you get a patient out of there that never has to see you again, that's a win because there's more people that need to be helped.
Absolutely. On the other end, talk about the most unethical, immoral thing that one can do as a provider is not be motivated enough and care enough to put the work in to try to get it so they don't have to see me anymore.
Yeah.
Right? The goal is that they no longer, mind you, a lot of people can want to come for counseling, therapy, fine. But as far as like the medication part of it, that is a good goal. Now, there are people that would just do better on medications. Patients that have like generalized anxiety disorder, recurrent depressions, significant severe trauma. So I don't want to make patients out there feel bad that need to stay on medications long term. There are patients that are best served staying on medication long term. Is there a cohort that can get on and get off after putting the work? Yes, but there's also a significant amount of patients, perhaps the majority. Again, I'm seeing patients that need to see a psychiatrist that will do better on medications long term. Life is rough. People have had rough histories. They've been traumatized. They've been through loss. They've been, they have family history. There's a genetic predisposition to depression or generalized anxiety or whatever.
Yeah.
So there are a lot of people that need to be on
And
meds
if this
long
gets
term.
them back to their lives and
God bless them.
there you go.
Yeah, a type 1
Done.
diabetic needs to be on insulin for the rest of his life. Okay. Some people need to do better on meds.
Great way to put it.
Yeah.
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 Okay. So that was depression, anxiety now.
Anxiety. So let me reorient myself to the question. So what is the question with anxiety? Remind me. Yeah. So we talked about depression. So here we're talking about anxiety and how to get someone to behave reasonably and rationally and utilize that front of their brain to overcome the disability of their overactive limbic system. And so I'll keep that.
Like pragmatic steps in coaching someone out of that place in life, especially when they have a problem with sticking to directions.
Yeah, I suppose this one's a difficult question to answer because a lot of the day-to-day work with like direct steps in their daily life is handled by their psychotherapist that they're seeing for an hour a week. So the role I take is a bit more zoomed out, kind of this quarterback, because I see patients maybe once a month, once every 6 weeks. So breaking down the step-by-step how to in their daily life accomplish that is usually done by the person that they're seeing more frequently. And I have patients that I see for an hour a week. It's just, I think, a little bit too individualized for me to be comfortable giving you like a great answer.
So there's not going to be any sort of like general rubric that our audience can follow. It's way too individualized for that sort of thing.
I suppose if I had to give a general rubric is with fear, anxiety, trauma, weighing out what is the, literally writing this stuff out in a journal. What is the objective evidence? What is the objective reality? And what is your subjective, fearful, catastrophic, the world is dangerous view of reality? Literally writing these two things out in a column and putting a plan, an action, behavioral plan into place that takes into account the real life risks and evidence and data.
Great.
If I had to just broad strokes.
That's great. I feel like that's something we can do like in another video down the future, because that's how I feel when I get like a workout program. It's like, here's a 6-month long workout program. But you're probably going to need a coach at some point if you don't know what you're doing, right?
Yeah.
And it needs to be individualized to you and all of these things. But I mean, that's like a nice general thing to be aware of, is like, okay, like I got it.
And don't feel bad if you can't figure it out yourself. It's literally my job to do this.
I don't think I could figure it out myself.
Exactly.
Yeah.
Life is difficult to navigate.
Yeah.
Pain is inevitable. There's always uncertainty. And life takes constant work.
Yeah, let me know in the comments if any of you feel this way. But for me, like I'm terrible at diagnosing or like talking about things about myself. I'm much better at doing it for other people. Trying to stop and think about myself. It's not even something I want to do. I don't even know.
It's a fascinating point. I will say one of the many impetuses for me to really dive into anxiety is that when shit is going wrong in my life, I tend to get anxious and obsessive. So a lot of what I have learned about treating anxiety and that kind of like that obsessive trying to get control over a problem that's out of my control has been through just trying to like literally therapize and understand myself when I'm suffering.
Yeah.
Which is one of the reasons I love my job, right? Because it's just you utilize it for yourself, relating to others. Anyone that's considering taking a job in therapy, psychology, psychiatry, I highly recommend it. It's the best.
That leads me to another point. We had someone ask him on Instagram if he ever takes his work home with him, if it ever affects his mental health, right? Well, that was a really interesting question. I feel like it would for me, but getting to that, your answer was no.
My answer was, I would say 99% I don't take things home. At least not in a distressing way. I will take things home in a curious way. But how many times have I been negatively impacted emotionally at home from one of my cases? I mean, I can count it on one hand.
Yeah. I think your response, which I really liked. Let me see if I can find this.
Yeah, let's see. What did I write over there?
I do my best to compartmentalize and not bring anything home. I can't say that my job negatively impacts my own mental health. In fact, it's oftentimes the opposite. Seeing patients improve and be resilient and have hope and accomplish often fills me with hope and motivation and pride and positivity and all sorts of other positive feelings. There are times, I will admit, that I hear something so disturbing, usually a patient describing a trauma, that it does bother me even after the visit, but I can't say it negatively impacts my mental health as a whole. And yes, I have been to therapy. Oh yeah, that's it. That was a separate question. But yes, I want to just encourage the audience to feel some semblance of like positivity towards the future, because when you do see people overcome heavy traumas or issues that they've been having with depression or anxiety or whatever else, like it should fill you with a sense of hope and you know, admiration for the resilience of
Absolutely.
people.
I'm inspired by my patients every day. I mean, I don't want to, not to sound like I'm tooting my own horn here, but the vast majority of my patients get better.
Yes.
Now, the
Good.
ones that show up to me are motivated. They got dressed, they drove, they paid my fee. So there's a selection bias here in which I have motivated patients, but the vast majority get better. They overcome a hell of a lot, and I'm inspired by them every day.
Yeah, and for anyone interesting who's lacking the motivation to get better, let this be a push for you, an impetus to, you know, maybe admit you got the problem and start working to get better and become motivated to get better and seek out whatever help you might need. There's people out there that can help you, and it helps a lot if you're motivated and willing to do the work. It makes their job easier and it gets you the results you want.
Absolutely. And if anybody, you know, I'm located over in West Los Angeles. We're in beautiful downtown LA right now. Perhaps we'll put something down in the channel. If people are looking for good providers in the West Los Angeles area, perhaps we'll help them, you know, find people in my network that I know are excellent.
Sure.
Yes.
Sure. Okay. With all the serious talk, I figured we should lighten up a bit, answer a few funny questions. I just have a couple of them here. These are ones pulled from your Instagram. So Lama Fashion says, completely scared of elevators, won't ride them.
Sack it up. I'll go exposure therapy, right?
Yeah.
What is your subjective fear? How much are you, what percentage chance that there's going to be some sort of negative outcome? What is the objective evidence? Fear system versus that prefrontal cortex. And if going in an elevator is 10 out of 10 in fear, let's figure out ways creatively with the therapist, CBT therapist, to find ways to ease you in. Again, if you panic, it's not helping you.
Azel Arthur says, how to deal with people in healthcare setting. I work in hospital, who randomly analyze another coworker thinking they can analyze professionally and have no credentials like education or experience whatsoever. The crazy thing about this is that these people are so convinced that what they think is undoubtedly correct.
Yeah. And how does that make you feel with these people, right? Are they inviting this sort of relationship with other people in their life? Are they think that they're able to analyze these people? Are they lacking humility?
I think it speaks to a lack of empathy as well, right? Like it's a misunderstanding of the real struggles people go through and just thinking, I know everything. And
yeah,
this is obviously what's happening with you and you should get your shit together, right? It's a misunderstanding of how deep people can actually go into their problems, right?
And if someone's doing something that annoys you, chances are they're doing something that annoys a lot of other people. And part of my job is literally evaluating someone professionally and analyzing them. And if they make me feel annoyed, it's literally my duty to, at some point, depending on how fragile they are, in a systematic way, bring it to their attention. How are they fucking up the relationship with me? And are they fucking up the relationship with other people in the same way? Transference, countertransference, how that patient is making me feel is monumental data for how I'm going to treat them. So if they make me feel annoyed, you bet your ass we're going to be working on that.
Can you define transference real quick?
Transference is all the feelings and everything that they come and they put on me, regardless of like the actual interactions that we've had, how I make them feel. And countertransference is how are they making me feel towards them.
Interesting. Soldier Sister 24 says, I would ask, but I don't want everyone knowing my stuff.
I don't even get what she's saying. She would ask, but confidentiality, HIPAA.
Well, no, I think she's talking to what I was speaking to earlier. It's the willingness to admit you have a problem as opposed to stuffing it down inside and just carrying on with your day.
Yes,
right?
defending yourself against your own feelings. If you keep suppressing or repressing distressful feelings, sadness, guilt, whatever, then that comes back to the first thing we talked about. You got to be in touch with your feelings. Those that aren't and keep shoving it aside or kicking the can down the road, that's going to link to depression and anxiety long term.
Yeah, not saying you have to share these things in public, but just if you do have something to share, consider sharing it in private with a professional.
With someone
or
you trust.
Someone
Exactly.
you trust.
Bingo.
All right. Elizabeth Ermter says, why are you wearing scrubs?
Believe it or not, psychiatrists are MDs. I went to medical school, did an intern year, and part of that is being in the hospital, treating patients. You're a doctor in the hospital. We wear scrubs, and sometimes you just look cooler online if you're wearing scrubs, even if you're a psychiatrist.
Totally. Lori Veach says, I've noticed when I'm stressed or anxious sometimes, I smell things that aren't there, like dirty clothes. Is this common?
Not common, a little weird. Weird. Now, when people can have perceptual changes when they're feeling distressed, specifically anxious. They can have changes in their vision, ringing in their ears. Smelling something that's not there also happens. Rare.
Yeah. Do you think that's indicative of any other sort of ailment, or you wouldn't worry about it too much?
I'd have too many questions. I don't know. We'd have to dig through that one.
All right.
Or maybe there's a dead possum underneath your house.
Yeah, it could be a dead animal.
Yeah, save the thousands of dollars on analysis.
Go look
and
on
hire
your
someone
porch.
to look. Yeah, exactly.
All right. Talha Vanzil says, anything about healing from betrayal trauma relating to your partner's secret porn addiction? Porn addiction.
Porn addiction. That's a whole topic right there. I suppose the pertinent point here is forgiveness, right? What does it usually take for someone to forgive somebody else? So if someone has wronged you, typically you need to see that person acknowledge the wrong, the transgression, the damage, express remorse and apologize, and then correct the behavior before one can forgive. That's this arc of forgiveness that's usually needs to be present before someone can forgive someone.
And then once all of those things are settled, I'm sure it's not just an easy cakewalk to forgive anyways, right? Then it starts a whole nother set of counseling to get them to be able to forgive.
And just because you forgive someone, which you don't have to, but just because you forgive someone doesn't mean you're going to choose to trust them again. Some damage is permanent. Yeah.
Great point.
Yes.
Some damage is permanent. We're not looking to forgive everyone for everything, no matter what. I mean, I know, certain religions or whatever, they really put forgiveness highly at all costs. But we're talking about secular mental health here. And these are the things you've seen that work.
Yes. Okay, Jeff.
Thank you for joining me today. That concludes the end of this podcast. I hope everyone enjoyed. Leave comments if you have any specific questions, because this will give us things to talk about in the future. We want the comments. We want to hear your thoughts. Good or bad, doesn't matter.
And also what topics you'd like us for us to cover in the future episodes.
Absolutely.
Okay.
And,
Thank you, everyone.
Thank you.